So I was on this tour, and one of the other actors asked if I'd be interested in doing some medical simulation work that they were involved with. And I find the whole field fascinating, to be honest. I think being able to help people whose job is so challenging at times is really rewarding. I don't know if I've got the strength of character to do the job that these people do day in, day out, but being able to help them through that, to help them help patients and relatives, to help them avoid burnout, I think is a really important role. And it's something I'm really pleased to be involved with.
So here at the University of Nottingham and in our graduate entry medical course, we run clinical skills over the first 17 or 18 months of the students' training. And communication skills is an essential theme within that course, together with exploring symptoms, physical examination skills and professionalism. So it goes without saying really that we couldn't do the kind of communication skills training that's necessary for our students unless we were able to work with patient simulators. The aim of a clinical skills course is that the students work in a safe environment where they're free to make mistakes and they can receive feedback on their performance and then rerun and rehearse new aspects of dealing with it.
Over the last 13 years or so teaching medical students, we've used patient simulators, the actors, in our teaching, and I think that it's been absolutely fantastic. The actors are very experienced, they're very knowledgeable, they're both actors but they're also patients themselves in their own rights, and I find that having them in the group teaching is a really amazing experience.
So before I start, can I just take your name and date of birth?
Stanley White, 23rd of January 1976.
Okay. So why did you come in today?
Well, basically because my sister's been nagging me saying that I've got to go to the doctor, and the only way to shut her up was to give in, to be honest.
Okay.
I just have this cough, I keep coughing up loads of phlegm all the time. But yeah, it can get quite a hacking cough sometimes, but when I tried my sister's inhaler a couple of weeks back, it actually helped a little bit.
Right, okay.
But she's like, "You're not stealing my inhaler, go and
Yeah.
get your own."
Okay.
And since then she's been on me all the time, so yeah, here I am.
So how long has this cough been going on for then?
Oh, ages. Probably about 4 years I've been bringing phlegm up. Well, even longer if you count winter. Like, it used to just be in the winter, and now it's all year round.
Yeah, so is this affecting what you're doing day to day?
Well, it's a bit embarrassing bringing up loads of phlegm and stuff.
Yeah.
Like you have a big coughing fit, and all of a sudden you've got a handful of phlegm. I mean, so I guess it's affecting like that. Yeah.
Okay. And is there any pain in your chest? Associated with that?
Not really. I mean, like if I've got a big coughing fit, like I can get a bit breathless.
Yeah.
They come and they take part in our communication skills teaching. They will have roles that we write. So the roles are really based on experiences that we've had in our consultations with patients. They're real patient experiences. They're true to life. And the actors take these and play these roles. They're able to be interrupted. So, for example, if a student, particularly at the very beginning, is struggling and finding it difficult to take a history, we can just stop straight away and there's no issue. The actors can change the emphasis in a role any time that we ask. If there's a particular group where there's an issue, then that can be changed. And then at the end of the student taking the history, the actors have a pivotal role in feedback. So for the last few years, I've been responsible for booking in the actors or the patient simulators that work here at GEM. Luckily, before I started booking them in, I had a strong group of people that I knew through doing the work for over 10 years now that I could rely on. Obviously, as things progress, we need to find fresh blood. So the way I do that is
obviously I've got connections within the creative industries, and I will turn to those. I also have various channels like Facebook and a website that I use to recruit. There are forms people can fill out to apply. I tend to talk to them quite rigorously. If they haven't got a lot of experience in doing role play, then I'll want to see them doing some role play. We might get them along to observe a few sessions here.
Yeah, I love working at GEM. I give feedback mainly on the patient's perspective, but I also add in my experience that I've gained over about 15 or 16 years working on, particularly with doctors in their examination situations, and try to pass on my observations, how people have handled certain situations in the exam, because it's all kind of time based.
And then I'll go and talk to the doctor and come back and talk to you together, if that's okay.
Yeah, that's fine, Rob. Yeah,
Okay, can I start by taking your name and your age?
yeah. It's James White,
James.
and I'm 60.
Okay, James. So, can you tell me a bit about why you're in here today?
Well, I've been here 2 days. I came in the other night, talking about how old I am. The wife and me, my daughter, organised this surprise 60th birthday at our club for me. And there's a lot of people there. And somebody gave a speech during the course of the evening. And I hadn't had a drink at this time.
Okay.
Somebody gave a speech, and I got up on stage with my wife to respond. Right, so. And just as I started into my speech, I got about 2 sentences. And all of a sudden, my mouth, I lost. I couldn't control my mouth. My speeches were all slurred like that. Everybody started burst out laughing. Couldn't believe it. You know what I mean? They thought I had some ale because they know I like a drink.
So if I can just summarise that back to you, so I make sure I've got everything right. So you're 60, and 2 days ago was your 60th birthday party. Is that right?
That's all.
Okay. So when you first start medical school, you don't really have appreciation of how important the history really is, and you get told that the history is the #1 most important tool that you have as a doctor. And you really develop this appreciation as the course goes on. And there are subtle skills about communicating with patients that you don't really get to practice apart from when you've got a patient simulator. And that's why the patient simulators are integral to the medical school. And that's something where you can go in and you can start practicing making those mental models of how you actually talk to someone in the first basis, and then also how you start to delve into their story and how you get to access that story. Because actually a normal conversation is fine, but there are stages in your head that you have to build up that the patient facilitators are integral into practicing, so that when you do actually come to talk to a real patient, you're precise and you're efficient at gaining access to their story, and especially the most important clinical parts of that story. He's come in today because 2 days ago he had an episode of a possible TIA where he lost sensation down the left side of his body, had difficulty with his speech, and also had numbness as well. He had it in the evening for a 60th birthday party, and then subsequently made it home where he lost his balance due to weakness in his left leg, and his wife subsequently called the ambulance and he came into MAU. He has hypertension, which is managed with ramipril. He also has type 2 diabetes, which was diet controlled but is now on metformin. He lives at home with his wife. There is a family medical history of both his parents have had strokes.
So I've been asked to talk to you today before you see your GP. Will that be okay?
Yeah, okay.
So all the information I gather will be relayed back to the GP, and then you'll be able to see them.
Okay.
And can I check your name and date of birth?
It's Alex Fisher, 1st of October 1961.
Okay, for me to call you Alex. Okay, so why have you come into the GP to do this? You say it was the one hand at first.
Yeah, at first it was just my right hand.
Okay, and how long ago did it change to both hands?
It's hard to say exactly when. I don't know, maybe within the last 5 years, maybe.
Okay.
It's spread to the hand. It was a very gradual thing.
Okay.
I think that the hardest part of the job, though, is probably the feedback, actually. Most actors can pick up a role, learn the facts, and give that role convincingly. But being able to give targeted, focused feedback on how people communicating is actually quite a talent, quite a skill. So I think being able to observe that and know how to deliver feedback in a positive and constructive manner is something that people need to learn quite well before they're released, as it were, on students here. But it's something that we're very interested in building up.
Very well. I felt very comfortable talking to you. There was a good explanation at the start of why you wanted to talk to me. You can maybe add in the fact that you then feedback to the GP. I'm not sure if you actually told me that much, but you explained why you wanted to talk to me, and that was fine. I was perfectly happy to do that. I think there's a few more things you could ask me, maybe more specific questions as well. I think you asked me about numbness and thinking, but there's a few more things I won't say what. But yeah, generally, apart from the few small things, I thought your manner was great, your body language was good eye contact, and I felt for a guy who doesn't come to the doctor very often, who might not want to talk to anybody other than the doctor, I felt comfortable talking to you.
Okay.
Yeah. So,
I thought it was a terrific consultation, personally. Your listening skills are good, you picked up on all the cues, your body language was good, you get great eye contact all the time, and that always beats to me, like, confidence. You kept a great focus. I've always been a big fan of summarising once you've made a presentation, and then you got into I straight away, and then you summarise, so you got a massive picture of where we're at. And after that, you just drove it through.
So they feed back in the role of the patient, and then they'll feed back as the actor as well. And those years of experience and knowledge come through. I think the students appreciate this feedback that is really quite different from feedback given by each other and by the tutor, because they start to understand how it might feel for a patient listening and speaking to them as a medical student. So a recent example is that we had our first year students in one of the very beginning sessions of communication skills. By the end of 1.5 hours, the absolute intense emotions that were engendered by the scenario, by the actor, by the way that the whole case was run were just amazing, and we were all incredibly emotional. We were involved in that scenario. It was that a patient was receiving his results. He had a real worry that he had cancer, and this worry was felt by all the students, and they completely forgot that they were being watched by their colleagues. As a group, when we were watching, we were involved in the emotions of the patient, and I think it drew the group together. The group supported each other, the group supported the student that was taking history, and really felt a real empathy for the patient.
Good. The patient said, "Hello, doctor," and you clarified that. I think you probably could have said, I'm not the doctor, I am a medical student, but you did say you are a second year medical student. And you said that you said what the agenda was, and you said what's going to happen afterwards, which was great. Gathering information, you gathered a lot of information, and you were obviously listening because you've done a very detailed summary after the patient had spoke for quite a while, which was great. And you established dates as well, which was good. You asked about the timeline of it. The first summary was really good. I did think that you summarised about 3 times though, which was a bit time consuming.
Feel too much, yeah, it was a long history, wasn't it?
It was, but very detailed.
So I was structuring the consultation. It seemed really like definitely ticked all the boxes in terms of stuff you needed to get, and there were a lot of summaries, but I think especially the one at the end kind of triggered you to, I'm not sure if it did, but it seemed to trigger you to remember to ask about smoking and drinking, because as soon as you started finishing that summary, you started asking about that. But I thought it was quite nice, and you got ice in quite early, which was really good because that kind of elicited about the family history of strokes, and that really went into that, and that kind of really opened up a lot more to talk about.
It's very gratifying as well to see how students develop, because we come in when they're in the first year and they're very green and kind of very nervous in terms of appearing in front of their own peers.
And for me especially, I look forward to probably more than anything, getting to talk to the patient stimulators, because they are the ones that come in, and they're great actors as well. And they come in, and they give you a full story, and it's very convincing. And you can come in and really think about an actual presentation. And because the presentations are clinical, not only is it a way of practicing communication skills, but in a sense, it's actually a way of building up a clinical picture of what somebody might actually present with in terms of their clinical history.
Comments. I like to pass comments on things like body language, which I've learnt through my acting experience and my acting knowledge and the studies that I've done on acting. Listening skills, body language, eye contact. How good eye contact to me always looks as if the person's very confident in what he's doing.
So in summary, for the last 4 years, you've been having a recurrent cough that's worse in the winter. You're coughing up either white or yellow sputum. Sometimes a bit of red tinge to it.
Yeah, it's got reflex.
And sometimes a little bit breathless.
Yeah.
But not really too much pain associated.
No, I'm not like getting pain in my chest or anything.
Okay. And pain anywhere else?
No, like I said, the throat sometimes, that's it.
Yeah. Okay. And is this the first time you've been to the doctor in those 4 years?
Yeah, about this, yeah. I think I had some travel jabs and stuff a while back. Yeah, well done, because this is the first time you've actually taken history from start to finish, isn't it?
Yeah, very much. Yeah.
And you probably weren't expecting someone that's a little bit hostile to speaking to the student.
Yeah, I didn't really know what to say.
No,
are we supposed to say, just go straight to the doctor?
Moving on, so we got an opening statement. It maybe wasn't quite as long as you were hoping it would be, because obviously he's not in the most chatty frame of mind.
Yeah.
But also, he's in a hurry.
Yeah.
And some patients will think that the most efficient way to get through and give you all the information is to just be quite succinct and give you quite closed answers. Yes, no, a bit of red. Whereas, in fact, you want them to be giving quite open answers. And the way to do that is just keep on with the open questions and prompt them for more information. Can you tell me a little bit more about that? I see. And just give those non-verbal cues to help people keep talking. I think there were quite a few nice open questions, but it's important as you work to use close questions as well. You can't get through an entire consultation, especially in 10 minutes, using just open questions.
But yeah, it's a great place to work. The staff are very good. There's a good mixture of skilled in the people that assess the students as well. So it's a good place to be, good place to work. And it's nice to know that you're helping people in doctorship for the future of the country, really.
So if you are interested in becoming a patient simulator, you can go to my website. The website is www.procomskills.com, PROCOMMSKILLS.com. There'll be a button at the bottom of the page where you can press, just saying work with Procom Skills. It'll take you to a form where you can submit your details, and someone will be in touch.